Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
So our question today, is it DHEA-S or is it DHEA? What's the difference and which one should we order? I'm Mitch Ghen and I'm here to try to help you with these type of questions every week. DHEA or dihydroepiandrosterone is found in two forms in the human body, and it's produced in the adrenal glands, but also in the brain, ovaries, yes, and the testicles. DHEA-S, or the sulfated form, is 98% in the circulation, and it's bound to albumin. DHEA unconjugated has a strong diurnal variation, whereas DHEA-S doesn't. But both will modulate the synthesis of neurotransmitters, but does so from a pretty different angle. DHEA is changed through a sulfatase enzyme to DHEA-S. But the reaction is bidirectional, which means that through a sulfatransferase enzyme, the DHEA can convert back to DHEA-S. The half-life of DHEA-S is up to about 10 hours, where the DHEA itself is only about 15 to 20 minutes. Basically, DHEA unconjugated is released in bursts as your body needs it. They are typically measured in different scales. You should be aware so you don't get confused. DHEA-S is measured in micrograms per deciliter, DHEA in nanograms per deciliter, and it is weakly an androgen compared to DHEA. So what do we measure? Well, if you have a patient and you're trying to determine the source of their hyperandrogenic state or activity, such as polycystic ovary syndrome, or if there is a androgen-producing tumor, then the answer is simple. It's the plain DHEA without the sulfate, just the unconjugated. In all other conditions and occasions, including your wellness profile, the DHEA would serve the best purpose with the S. DHEA-S regularly, and if you suspect that there could be a tumor or PCOS, then the DHEA. Remember, there's a difference when you look at the way each one of them are reported out, one in, of course, the micrograms per deciliter, and the other one differently as we served before. Get with it. You'll see if it will help you, and hopefully it will help you the best. Remember, when you're checking saliva, that saliva is DHEA. It is not the bound. And also remember, when you're giving someone DHEA as a tablet, that will be converted by the liver to DHEA-S. Okay, if it's not confusing, you know how to use it now. Get to it. God bless. I'm Dr. Mitch. MitchGhen.com. If you want any more information, it's Dr. Mitch Ghen, DrMitchGhen.com. See you soon.